It's important to do research, but research needs to lead to innovation and to policy.
Herman's real strength is he's a real visionary, and he really thinks about what the fundamental questions are. So he understands agriculture, he understands veterinary medicine, he really understands epidemiology, which is his area of expertise, and he puts all that together.
He's a giant in the field of veterinary research.
People often think of scientists as people in small dark rooms doing things, but Herman's probably the opposite of that. He's comfortable talking at an international conference as he's in a barn with a group of farmers. And it's that approach which allows him to identify key challenges and then bring the research community together to actually then bring impact to research.
We are facing right now very important problems that need to be tackled together.
The University of Calgary is one of the leading research-intensive universities in Canada. One of the priorities of the university is this area of One Health. So what One Health is, it's an approach to research which recognises interactions between animal health, human health and the environment.
And transmissible diseases like infections, for example, needs to be understood and controlled by taking this three-pronged approach.
What happens in one part of that ecosystem affects each of the other sectors within that ecosystem. Nothing is contained in the world because we're a very mobile population.
His expertise is related to infectious disease, Johne's disease, and antimicrobial resistance, which is perhaps the one that he is globally most well known for. And all that under the umbrella of One Health.
He's, over his career, brought in more than $50 million in funding, and he's used that to do a lot of research, to train a lot of graduate students, to publish a lot of papers in high-impact journals. And the relevance of his work is that it's really changed, in many ways, how we manage mastitis in dairy cattle, and that impact's been around the world.
It was a really important piece of work which really showed the connection between antimicrobial use in animals and the impact on human health. And that's actually led to both policy change at WHO and a policy change through many of the national governments, including Canada, including in Europe, which have produced quite a significant reduction in antimicrobial use in livestock. Without those kind of efforts, all this research would be just still research and wouldn't be having an impact in society.
And whether that is in the dairy industry, where I've worked a lot in, or in human health, science-based, evidence-based medicine and practices are essential.
I think he's a fantastic example of natural enthusiasm for what he does, leading to success.
He's an international leader in many initiatives related to the field, including Singapore, China, just started a program in Indonesia, Vietnam, India, and that has eventually actually led to the establishment at the University of Calgary of a World Health Organization Center on Antimicrobial Resistance. I would say that the research excellence and the leadership that he brings to the table, as well as his enormous international network, is hugely conducive to collaborative success.